Hello and welcome to the Oakland County Megacast in the Green Media Center studios. I am Tyler Kieft, and joined as always by my other host on the show, Ronnie Dahl from her home studio.
Happy Monday to you, Tyler. What a weekend. We had snow and the Lions lost.
I'm shocked.
What a Michigan weekend for you, right?
That is the quintessential November weekend in Michigan, Ronnie.
Well, the good thing, the snow is melting already, and it looks like it's going to be a good week for Thanksgiving, at least on Thanksgiving Day, because I'm going to be out running in my turkey outfit. So It looks like the weather is going to be good for Thanksgiving. However, the question is going to be, will Patricia still have his job at the end of the week? Because I will say, I don't think the Lions are giving fans anything to be thankful for right now, Tyler.
No, they certainly aren't. And what I'd like to see happen is they roll Matt Patricia and Bob Quinn out on Thanksgiving Day at Ford Field. They roll out a nice ceremonial turkey, and they do a ceremonial cutting of the turkey. And as they cut in, both Matt Patricia and Bob Quinn with separate knives, they cut into the turkey, and in there's a note. And on the note, it just says, "Get out, you're fired." And then they hit the bricks. That'd be great.
Well, and the thing is you can't feel too bad for some of these coaches, because if they are fired, they walk away with some sweet severance packages. And the Lions have paid out a lot in those packages over the past, decade or so.
It's one of the most attractive parts of the Detroit Lions job, I would imagine.
But I will say, you know what, Tyler, you're a huge sports guy. You know so much more about sports. I'm just the fan that, not really even a fan. I always say, why am I going to watch 2.5 hours of a game when I can catch the highlights in the last 2 minutes? And in all honesty, with the Lions, that's the only part of the game you need to watch, because so many times they're up the first half of the game and it gets your hope up.
Right.
And then they blow it. So who would you like to see coach the Lions?
Ooh, that's a tough one. I really like the Kansas City Chiefs offensive coordinator, Eric Bieniemy. I think he's an excellent candidate. He's helped Andy Reid build that offense. It's more of a modern NFL offense in Kansas City, so I think he'd be an excellent coach. Certainly there are other defensive coaches around the league that would be fantastic as well. Robert Saleh is the guy from Michigan that's the defensive coordinator in San Francisco. Has been someone that's been thrown around a lot, but I'd first like to talk to Eric Bieniemy of Kansas City, because they've been consistently good for several years. He's good at developing young talent, and I'm thinking we're going to have ourselves a new quarterback here in Detroit with the Lions pretty soon, with Stafford getting up there in age and also not entirely probably wanting to be in Detroit much longer.
Look, Stafford is a good enough player. He shouldn't be here. He deserves to be on a winning team. But put that aside, some people really feel like the Lions are cursed, and that curse is not going to be lifted until the Fords no longer own the team.
I would agree. Yeah, they are the problem. They're the most consistent part of this issue with the Lions over the course of their history.
Oh, but you know what? The Lions fans, they're diehard. They're going to continue to support the team, although I will say it's going to be very different this year on Thanksgiving, because fans will not be in the stands.
Yeah, it's gonna be an interesting Thanksgiving all across the NFL. Some places will have some limited number of fans, but in Ford Field, it's going to be a much quieter environment than it normally is on Thanksgiving Day.
Oh, but so a lot of traditions are changing this Thanksgiving. But you know what's not changing? Despite the CDC warning, so many people, Tyler, are still choosing to travel this Thanksgiving weekend. And looking at the day's headlines, millions of Americans bought their tickets to fly somewhere for Thanksgiving before the nation's top public health agency pleaded with them not to travel for the holiday. So what are they doing now? Well, in many cases, they're still crowding airports and boarding planes. That despite lenient cancellation policies that major airlines have implemented since the coronavirus pandemic emerged earlier this year. More than 2 million people were screened at U.S. airports on Friday and Saturday, according to the Transportation Security Agency, or administration rather, sorry. While that's far lower than during the same time last year, Friday was only the second time since mid-March that daily airport screenings topped 1 million. And that kind of puts it in perspective about the airline industry and people traveling right now. Only the second time since mid-March. However, people are still traveling right now, despite the CDC's warning. Tyler, I don't know if you watched the news over the weekend, but you saw the pictures and you saw the images. Airports were pretty packed.
Yeah, they were pretty packed in, and their numbers have still been down from what they normally are this time of the year, but they've certainly been up from where they were in the past several weeks, as there was extremely limited airline travel, as there has been throughout this pandemic by the general public. But a lot of people traveling this year, the numbers have skyrocketed at airports, and the numbers in terms of people who are electing to travel at this time of the year. And this is exactly what health officials are warning against: mass travel, in which the virus can spread state to state and then or place to place, and it can become a lot tougher then to track down the onset of these outbreaks, or to communicate between multiple state governments, multiple county governments, in order to contain these sorts of outbreaks. So it is definitely something that's concerning the health community and probably the wider community as well, that the numbers of people that are traveling for this, presumably for this holiday, we don't know exactly if that it was their intention in traveling, but you can presume that it is. That this is exactly the kind of precursor to COVID-19 spread that the Centers for Disease Control and our state and local health departments have been so vehemently warning against over the last few weeks.
Yeah, I think part of that has to do with, you have a lot of people working remotely right now, and now you have the schools that have shut down, so they're remote learning. Yeah. So you can pretty much do that anywhere. So if you want to travel to grandma's house, as long as she has an internet connection, you can do so. And people are making those decisions for themselves. But that also kind of goes into our next headline. What you were just talking about is the spread. Yeah. Because with COVID pretty much everywhere right now, contact tracers here in the state of Michigan are losing control to try to contain the spread of the virus. Michigan's public health system is becoming overwhelmed as COVID-19 cases continue to surge, outpacing efforts to contain the pandemic by finding and sequestering sick people before they spread the virus. The state has increased staffing, and contact tracers are investigating more cases than ever. State employs near 400 tracers plus 750 active volunteers. That's on top of hundreds of local public health workers who have shifted from their normal pre-pandemic jobs. But contact tracing only works if infection rates are fairly low. And then once a population begins to experience community spread, which is pretty much happening in so much of Michigan right now, tracing becomes a far less effective tool. So what's the state doing? The state is trying to encourage people to use the My COVID Alert app that notifies users when a nearby individual has tested positive. Over 300 people have signed up for that app, and in the short time that it's been up and running. And so it makes you wonder, because it takes a lot of work for some of these contact tracers. And not only are they overwhelmed because so many more people are being infected, on top of that, while they're trying to contact people and trace where the spread maybe came from, some people just aren't willing to give them the information.
Yeah, it's much like the situation with the restaurants, where people are going to give the information that they want to give. That's one of those drawbacks of the My COVID app on the state level, which would be pretty helpful to a lot of people if they're worried about being around potential outbreaks and they maybe aren't seeing those commonly coming up in their place of work or within their family, and they have similar concerns to what we've talked about, where every time you go out, you're pretty much in a position to be exposed. If you're going to the grocery store, that's a place that you could easily be exposed. There's so many people there. If you're going to a department store doing your holiday shopping, it's another spot where you can be exposed, even when you think you're really not being exposed and your guard is kind of down, because those are safe environments that people go to commonly and really maybe aren't even thinking about as much anymore as they are in close contact. So with the contact tracing app, it kind of makes it a little bit easier for the state to do that contact tracing, to let people know, hey, you've been around someone that may have tested positive, you may have been in close proximity to them, And you might want to get tested yourself, but there is that drawback too of people don't want want to be giving away their information, and if they're not willing to give it away to go sit down in a restaurant, as they were at the beginning of that regulation that became a recommendation that is now debunked because people can't eat in restaurants during this 3-week pause, then they're not as likely, I would think, to want to download an app that's tracking them on their phone also, even though so many of their other apps and their phone in general is tracking them all day long.
Yeah, and just so people know how the app works, is it is still anonymous. So people don't know your personal information or who is testing positive. They're just getting an alert. But one thing I was wondering about this is, if I know I've tested positive and I'm a part of the app and they have that information, shouldn't I be at home? Like, I mean, yeah, that's part of it, right? I mean, I don't know, crazy, but that could be a way to go. It's going to, until these vaccines are widely available, Tyler, we still have a long way to go. And there's so many different facets to this pandemic and so many different ways it's impacting our community. And one is really looking at women in the workforce, because after decades of studies or strides in employment, women are making a staggering exit from the workforce due to the pandemic. Experts say the shift may lead to challenges for women finding work, and they may face lower wages in the future. Across the country, more than 800,000 women left the workforce in September, compared to 216,000 men. Last month, the unemployment rate for women dropped, but there are still nearly 2.2 million fewer women in the workforce than back in February. So in Michigan, labor force participation among women fell nearly 6%, compared with a drop of less than 1% among men. That's according to information from the Bureau of Labor Statistics. One factor playing into women leaving the workforce, childcare. About 76% of the mothers with children under the age of 10 said childcare is one of their top 3 challenges during the pandemic. And so families are making those tough decisions. Do you work, bring in that money, or who's going to stay home with the kids? Because you know, if you can get into childcare, it's not so easy. Then the expense of it as well has to be crazy right now. These families are really going through so much, Tyler, during this pandemic and these decisions, because someone has to be home with the kids if they are remote learning.
Yeah, it's a tough situation for these parents, especially as we go further into the pandemic, especially as we have now multiple shutdowns that have happened, and schools have gone from in-person to hybrid to fully in-person to fully virtual over and over again as this pandemic has continued to cycle a hotbed of cases to a latency of cases over time. And so childcare again becoming that much more of a critical need in our communities right now, as people have been going back to work, as people are starting to have more complications, such as in-person learning being suspended, even at levels where it's not required during this 3-week pause at elementary and middle school levels. Many school districts are deciding to forego in-person learning at those levels as well because of the number of cases that are cycling in the local area, and to keep their staff safe, and in some cases because their staff has been exposed, and there's so many people that have been exposed but aren't positive and aren't spreading it to the kids or spreading it to those families, but they're running out of staff in that case too, because getting substitutes to come in is so tough. So there's multiple layers even to the rationale behind why childcare is so tough to come by, and why it's even more of a critical need right now than it has been before in this pandemic and before the pandemic altogether in more normal times.
You know what's crazy, Tyler, again, for people that may be just tuning in for the first time to this show grew out of the pandemic and trying to inform the public. And I know when you guys started it, you thought, okay, maybe a couple weeks, a couple months. This is 8 months into it. And the important reason we keep this show on is to have these conversations, because we're still in the middle of the pandemic, and this pandemic is not going away anytime soon, but the information changes daily. And it's hard to keep up with all of that information. But on top of that, we try to reach out to the businesses, the newsmakers, and the individuals directly impacted by the pandemic, which we all are in some way, and how they're working and how they're surviving through all of this. So that's one of the great things and great reasons why we do the Oakland County Megacast each and every day here on Civic Center TV, 10 a.m. to noon. You can also catch us on the Birmingham Area Municipal Access Channel, Channel 15 if you have Comcast, Channel 99, AT&T. If you're channel surfing, go ahead and tune us in. If you're out driving around, 89.3 Lakes FM, 88.1 FM The Biff. And we also want to say thank you to Oakland University. They are allowing us to live stream today's edition of the Oakland County Megacast on their Facebook page. So we want to say thank you to them. And speaking of Oakland University, our first guest up after our break is going to be a professor of bioethics from the university. So much information is coming out about the vaccine, new information coming out today that there is another major drug company that has announced that it also has a vaccine that's going to be coming out. There are a lot of ethics surrounding this topic of vaccines in general, but also especially with the COVID-19. I mean, we did the story recently where Ticketmaster was saying, in order to go to a concert, you're going to have a vaccine. So many questions. So we have a lot to get to on today's edition of the Oakland County Megacast. As I said, we'll be speaking to the bioethics professor, and then also the restaurant industry. Some of these restaurants have definitely taken a hit during the pandemic. The Hub will be with us around 10:35. Then we'll be speaking with the Troy mayor coming up in the second hour, along with the CEO for the United Way of Southeast Michigan. So hard for so many of these nonprofits because the need is up for their services, but it's hard for them to get the donations during this time as well. And then we'll round out the show speaking to a representative from the Orchard Lake Village. So a lot to get to, but we're going to take a quick break here on the Oakland County Megacast.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Great to have you with us on the Monday edition of the Oakland County Megacast. News came out this morning that there is yet another drug company, the third major drug company, to announce that they possibly will also have a vaccine for COVID-19. But there are so many questions surrounding the vaccine. Will people be willing to get it? And also, will it be effective? Joining us now on the Oakland County Megacast is Mark Navin. He is a Ph.D. and professor and chair of philosophy at Oakland University and a lecturer in the medical studies, Oakland University, William Beaumont. So great to have you on with us. Thank you for joining us on the Monday edition of the Oakland County Megacast.
I'm glad to be here. Thanks for having me, Ronnie.
so many questions. So I'm sure you saw the news coming out that yet another vaccine is in the works, and it looks like it's going to actually happen. Can we talk about the ethics surrounding some of the vaccines? And it's funny because my husband and I were having the conversation yesterday. Will people be willing to get the vaccine? Because there are a lot of people out there, parents, who don't believe in vaccines. So can the government make you get a vaccine?
Well, great. So as you note, there are so many ethics issues, and maybe as we get started, it's worth sort of distinguishing some, and then we can circle back on those that you're interested in talking about. But even in your question there's two different questions. One is ethics around acceptance, right? And so surely the government has an obligation to protect us by sponsoring and purchasing and distributing the vaccine, right? Improving availability and access and also awareness, but also they have an obligation to promote acceptance. And so what should we be doing better, right, as individuals and in our communities and through our government to promote acceptance? That's a real important ethics issue. But then, as you know, related to acceptance is what happens when that fails? What happens when we don't do enough to promote acceptance? What kinds of power can the government use? Either kinds of hard power by making refusal illegal or limiting our liberties or in various ways, our access to public spaces like schools or businesses. And what sort of power can private actors do, right? Businesses or hospitals do if their workers refuse. So I think you're right, huge ethics issues there. And more generally, there are a bunch of ethics issues surrounding the sort of differences between the vaccines. And happy to talk about the three major players right now, right? The Pfizer, the Moderna, and the Astra-Zeneca, which are each really distinct. And the two, mRNA ones, the Pfizer and the Moderna vaccines are going to present unique challenges for cold storage that are going to intersect with some of the ethics issues about reaching the communities that are most vulnerable and sometimes most in need of the vaccine.
Yeah, I'm really surprised with that. Why is one vaccine not require that, but the others do? And will that then make the vaccine that doesn't require the cold storage a more popular way for some of these governments to go?
Yeah, and it's trade-offs all over, right? So there's all kinds of uncertainty. Ordinarily, we'd be waiting, but now we're talking about December 10th for the FDA's committee to make an emergency use authorization. Now, the word emergency is there because they don't normally skip all the steps they're skipping, and there are risks involved in that. And we're all very excited, right, to see the Pfizer vaccine that's on the docket for December 10th to get approved for emergency use. But there are risks. We don't know what the long-term risks associated with that vaccine are going to be, especially because it uses a novel technology of introducing RNA into the body to use the body's own cells to generate the antigen that creates the immune response. So maybe a tiny bit of science here is helpful. So traditionally what vaccines do is they use a part of a pathogen are the things that get you sick: virus, bacteria, protozoa, fungi, worms, right? So those are the things that get you sick. Those are the nasties. And how do vaccines work? Well, they take a part of a pathogen that's either dead or inactivated, or they just actually cut a little piece of it and put it in the body and create an immune response with that, right? So they put something called the antigen in the body, which creates the immune response. RNA vaccines are so exciting because you don't have to take any part of the pathogen. There's no piece of the virus or bacteria put in people's bodies. You just put in a little bit of this DNA RNA code that works with the body's own cells to create the antigen and the immune response itself. Now, that is some fancy science stuff that we've done before with some other vaccines, but RNA is really vulnerable. And so, especially with the Pfizer vaccine, it's especially vulnerable. It has to be kept at negative 70 degrees Celsius. It's colder than winters in Antarctica, as people have been saying. And they're promising that combinations of dry ice and short-term storage and like hospital, deep cold storage is going to work. But those challenges are really hard, which is one reason to be so excited about the new Oxford AstraZeneca announcement, because they're using a more traditional way of making vaccine. They're using a sort of part of the virus, a part of the pathogen to create the immune response. And those vaccines traditionally just require normal refrigeration, which is so much easier to provide, not just through hospitals and big institutions, but even at local doctors' offices.
But one of the things I find interesting too, though, is a lot of these vaccines, it's a 2-dose process. So if we're looking at trying to do millions and millions of people, does that present a different sort of challenge? And how many people will actually go back for that second dosage?
There's so much uncertainty, as you say. And in fact, the preliminary results, which is all we have on these vaccines, are in some ways odd because they're so preliminary and the data is so small. So, for example, the very exciting new Oxford Astra-Zeneca vaccine that we're seeing preliminary data on, they actually showed, strangely, a better response on 1 dose than on 2 doses. Now, that's almost certainly an artifact of having small numbers. But you're right that it matters whether the vaccine is going to require 2 doses, right, versus 1, and how easy it's going to be to get and when we're going to be able to get it. America is very lucky as like one of the wealthiest countries in the world. We've bought up a huge chunk of the world's supply. I was just writing it down, right? So we've purchased 300 million doses of the Oxford AstraZeneca, 100 million of the Moderna, 100 million of the Pfizer, 100 million of the Johnson & Johnson still in development, 100 million of the Sanofi, GlaxoSmithKline, and a bunch of other ones too. We've bought almost 1 billion doses as a country. Because what's really cool about these vaccines is they've been making them as they've been testing them, because they've been crossing their fingers that it works, and that if it gets approval, then they'll be ready to sell them. And that is not normally how this works. You normally make sure you've got it, it works in the lab, then you make it. But they've been making them as they go. And so that's one reason why we're so excited to get started once we can sort of jump through these sort of approval processes and deal with these really tricky ethics, distribution, allocation, acceptance, mandate political questions.
Professor Navin, with that, where does that balance come into play then philosophically, ethically, and scientifically as they're preparing this vaccine potentially, or these vaccines potentially for distribution, knowing that there are so many risks with fast tracking this process that you normally take several years and instead it's taken several months, but also because the need is so great that it really has to be fast tracked. Where does that balance meet to a point where it is most opportune and a safe bet to some extent to green light a vaccine?
And this is a great question. And the difficult part is that the certainties are all on one side of the equation and the uncertainties on the other side. So we know, right, as Ronnie was saying in the previous segment, that women disproportionately are exiting the workforce. We know this is bad for kids, especially kids whose parents aren't able to throw tons of resources at them in a kind of homeschooling environment. We know that this is horrible for the elderly and especially for people in long-term care facilities. We know, just looking at the death and the morbidity associated with this disease, that's 100% certainty. We know that's going to continue and get worse. On the other side, we've got some really good evidence that some of these vaccines work, at least in the short to medium term. We've got good evidence that in the short to medium term, the risks of complications are, very low. We've got good evidence that the cold storage works, but in the short to medium term. But again, we don't know. I mean, I can tell you how long I can keep ground beef in my freezer. We actually don't know how long you can keep this vaccine in the freezer because we haven't kept it in the freezer that long yet. There's so much uncertainty, yet against the certainties of the bad, right, of the status quo, and the probabilistic information about the good of the vaccine, then the lurking issue is the uncertainties about the bad of the vaccine. And we don't know. We really don't. But a lot of people, and me included, think that these are reasonable risks to take. But they're risks. There's a lot of uncertainty.
Yeah, and with that, we have parents that already don't want to get their kids vaccinated with the standard vaccinations. So how do you put this into play if it's going to be required, in instance, if it's going to be required by a school district for their kids to come back to school? So there are going to be those discussions and topics, I think, going forward, government versus parent responsibility.
The short answer is it's very premature to worry about that, because in the short period, it's going to be accessibility and availability of the vaccine that we worry about. So everyone's talking, December 11th, we can start having this Pfizer vaccine. That's going to be a small amount of doses at hospitals. And even after then, at least following the Michigan COVID-19 vaccine allocation plan, it's going to be local health departments prioritizing which providers are serving disproportionately elderly or long-term care facility people or people who are otherwise medically vulnerable. It's going to be easily summer, maybe late spring, before sort of ordinary healthy folks are even going to have reliable access to this vaccine. And so I think that's a nice window in which we as a society can both sort of learn more about risks, but also be promoting acceptance, right? Be normalizing this behavior. So I can't blame anyone for saying I'm reluctant to do something no one's done yet. Right? It takes not everyone has the personality where they want to be the first person to do it. But once 20%, 30, 40% of the population has gotten this vaccine, let's see if we can shift these social norms. Let's see if as a community, right, we can make this a regular, normal thing and maybe reduce that anxiety. And then if there's 15% of the population left that's resistant, then we'll look at targeted, persuasive campaigns from government and from, but then, coercion is always on the table. But I think that's a last resort. No reason to talk about it yet.
Well, and you're looking at this, and a lot of people are concerned because they're like, this is being pushed. This is being pushed through the process. So there is questions about how safe is it, or is this being rushed too soon? Because this process before a pandemic never would have happened like this.
Of course not. Yeah. I mean, but here are the certainties. And here's another question about who is going to take it first. So I've got friends and acquaintances, perhaps you do too, that work in hospitals. And this is the underreported story of our time. These people are drowning. They are physically being sick and dying, and they are physically and emotionally, psychologically just exhausted. And our systems in the next week or two here in Michigan are likely to break down. We are very close to being out of ICU beds, but that's a misnomer. What we're really getting close to being out of is ICU nurses. The shortage last time we were worried about was ventilators. We're worried about now about healthcare staff. And that line of cases and hospitalizations is going straight up. And with Thanksgiving coming the way it's going to come, is going to go straight up for the next few weeks. Those people, I guarantee, those nurses and doctors are going to take, when they're offered the vaccine and they're going to get a chance to get it first, I guarantee they're going to take it. Because you're right, there's some risks, but their certainty that they're dealing with right now is so horrible that they need that vaccine. And I can't guarantee or speak for people in long-term care facilities, but I imagine grandparents who haven't seen their grandkids or almost anybody in 8 or 9 months and only have so many years left to live, they're going to prioritize being able to see people over some unknown risks of some longer-term thing happening. But you're right. I think here's the other issue. For healthy people, especially healthy young people, especially for people making decisions for their kids, it's not about your own kids, right? My decision to vaccinate my kids in general, but especially with this vaccine, is not about their health. It's about the health of other vulnerable people in the community. It's about people's grandparents and ill people. And so we as a society do a really bad job of talking about our choices in terms of helping other people and protecting other people from harm. But we're going to need to talk that way about COVID-19 because very few kids actually get serious symptoms from this disease. But the reason to vaccinate kids against it is going to be protect old people. But you're right, why would I risk things for my kid to help other people? And so we're going to need to assuage those worries about risks before we hit spring and summer and the vaccines are rolling out to healthy kids.
What's so fascinating about that is because we're talking about a vaccine, but we're having those discussions and debates in public right now over wearing a mask. And that's nothing that's going into your system. It's just wearing a mask.
Yeah, I want to shake my head with you. I worry about the intense politicization of public health measures that used to be consensus. And not that everything is about Trump, but things have gotten worse recently. And it's fun to wave our flag when it's our sports team. And even in politics under normal times, it's fun to have our team and our tribe that we're rooting for. But when it's common sense public health measures that are keeping people alive and helping to keep our economy going, and the only way to go back to work and go back to school is if we don't have a raging pandemic, and masking and social distancing and vaccines is the only way to solve that problem, it's the biggest disaster possible for that to be politicized. And I don't know how you get out of that.
And on the other side of that, we're looking at some doctors that don't allow or don't accept patients if their parents aren't willing to vaccinate their kids. I know you recently worked on a paper regarding that topic. Do you want to expand on that as well and how this new COVID-19 vaccine could play into this discussion as well?
Yeah, I think it's related to my sort of previous statement that I worry that when what used to be common sense public health measures get politicized, people tend to dig in and come further apart. And so I've written in other contexts about I'm not just worried about anti-vaccine people and anti-mask people, but I'm worried about the anti-vaccine people. I'm worried about people that now are sort of angry and want to punish and separate themselves from the anti-vaccine people. And one place I see that is in primary care, especially in pediatrics. That pediatricians increasingly are dismissing or refusing to accept families unless they agree to receive all the recommended vaccines. Even though the most commonly refused vaccine is for chickenpox, which is serious, but it's not polio. And so I've written, and others have written, that even though this is what doctors want often, this is not actually what's best for kids, and it's not what's best for public health. And continuing to sort of engage with and educate and persuade families is our only hope, even though it's often a long shot.
Mark Navin with us here on the Oakland County Megacast. He is a Ph.D. professor and chair of philosophy at the Oakland University and lecturer in the medical studies at the Oakland University, William Beaumont. With that, I just think this must be a fascinating time for someone in your profession facing so many of these issues. What is the conversation going to be for you and your family around the Thanksgiving dinner?
Well, it's going to be a small dinner this year. It's just my wife and I and our 3 kids, and my parents and my wife's family live out of town, and we usually either travel or come together. And weeks ago, we decided that it just wasn't going to work. That those risks, especially to our grandparents, were not, they were not low enough. They were too high, right? And so therefore willing to make the sacrifice. I think for my family, I'm not as worried about the risks. Part of that is I'm just very pro-vaccine to begin with, and the studies we've seen show basically no serious short and midterm results of these vaccines, and in fact the RNA vaccines, which maybe sound scary to people, are actually safer than the vaccines we traditionally have because no viral materials are actually ever in your body, and this RNA, once it sort of creates the antigen, dies instantly. So the thing you've injected actually goes away almost immediately once you put it in the body. I mean, there's a chance for, even though vaccines already are super safe, these are, if they work and they look like they work, going to be the safest vaccines we've ever had.
Yeah, can we talk a little bit about how this conversation really even got started about with the anti-vaccinator parents? I know there was some people that believed back in the day that the vaccines that were required were associated with autism and other side effects such as that. Is there any validity to those arguments?
Yeah, absolutely not. The most studied and over-researched topic in vaccines and maybe even science is that vaccines are not associated with autism, right? Both in sort of experimental, quasi-experimental, and observational studies. No relationship at all. That being said, I want to frame the question a little bit differently, which is that we shouldn't be surprised to see anti-vaccine people. In fact, we should be surprised to have seen the long decades of consensus that vaccines are great, because vaccines are fundamentally weird. I'm pro-vaccine. All my kids are fully vaccinated. Heck, I volunteer or work at the hospital, and so I went and got my MMR redone because my titers were low. I love vaccines, but they're weird. That they are injecting healthy children with antigenic material in order to protect them against diseases they haven't gotten yet. We don't do other stuff like that. And so I think it requires decades of cultural buy-in and socialization to get people to think that this is a non-issue. And so it's not so much that, the anti-vaxxers came out of nowhere, but that we have failed in our social, political, religious, interpersonal institutions to continually regenerate, because it's every generation's task, right, to recultivate our trust in our institutions and in these fundamental practices of social cooperation. And we've broken down, and you see that failure and that breakdown of institutions everywhere. And so it's no surprise that the vaccine sort of consensus has fallen apart, much the way other kinds of consensus have fallen apart in this country.
So is the COVID-19 pandemic an opportunity to try to reframe the conversation? I
hope so. The problem is, here's a couple of problems. So one problem is it's such a discrete thing that so you see, for example, the last week, some of the Republican governors reversing themselves on mask mandates. They've said, okay, it's gotten bad enough, I've changed my mind. Even if it's the case that they've really come around, after the pandemic, what remains? I don't think that's a lot to build on. So another way of putting the point is, if fear of death is your only basis for us cooperating with each other in politics, you're kind of doomed unless you start a perpetual war with some, mutual enemy that we're constantly afraid of killing us, much as what worked in the Cold War, right? To cultivate bipartisan consensus on a lot of policy. We're all worried about the Soviets nuking us, and that was actually really helpful. Scary as hell, but really helpful. I don't think you're going to generate the same kind of long-lasting fear out of pandemic worries, because this is going to go away if we're lucky in the next year or so. But I do worry, in the absence of a common threat, either of disease, natural disasters, or war, or China, what can be the basis of our shared political identity and our cooperation? We're very far apart as a country right now. And I really worry about what that means for public health and for everything else we try and do together.
Yeah, because public health is, it really is the way that we are all connected. And public health does bring us together. And in some way, you would think that maybe this pandemic would help unite us, but it seems it's done the opposite.
Well, and there's research that shows in previous outbreaks that outbreaks do not overcome committed vaccine refusal. And in fact, they reinforce people's existing vaccine refusal. The people on the fence who are wavering a little bit, an outbreak and that bit of fear can be enough to bunch them off the fence. But people whose identities are already wrapped up in rejecting vaccines or rejecting masks or rejecting social distancing, or the fear is not going to be enough, right? In fact, it largely, as you suggest, entrenches them in their existing commitments.
So I know you don't have a crystal ball, but let's say, okay, we get the vaccine and it's starting to be widely available. Because now we're even seeing issues with testing and the shortage of testing supplies once again. But also it's the accuracy of some of these tests and the uncertainty surrounding this pandemic that is adding, I think, to the confusion of the discussion. But what does an employee or an employer face in the future? Is it going to be pretty common that we're going to have a vaccination and show proof of that vaccination in order to do so many things that we do right now? Well,
I think you're
pre-pandemic.
I think there's a lot of uncertainty, so the short answer is it depends. But I think it's unlikely, and here's why. The seasonal flu kills tens of thousands of people every year, even with vaccines. And as it is, though, only some employers, right, like healthcare employers, require their employees to get that vaccine. I strongly suspect that with widespread COVID vaccination, we're going to see death rates of COVID that start to get close to seasonal influenza. Which is to say, it's a similar kind of risk. And given the similar kind of risk, if there are going to be mandates, I think they're going to be really narrowly targeted at those with at-risk populations. So people working with incarcerated persons, right, with kids in group homes, right, in hospitals. But that's a big guess. If we continue to see 100,000 people a year die of this disease, then I think it's possible that more employers are going to have mandates. I think that's unlikely, though. But here's another thing to consider. The recent move on the Supreme Court and in the existing government has been to expand conscience protections, especially for people who make religious objections. And so the Office of Civil Rights has dramatically, since 2017, dramatically expanded the rights of healthcare workers to refuse participating in interventions to which they have religious objections. And it applies to basically everything they do on the job, and basically all healthcare workers, from surgeons to janitorial staff. And so I strongly suspect that any new mandates are going to come with very expansive religious exemption provisions, which undercuts their ability to really be mandates. So first off, I don't think we're going to need the mandates as broad-based. But second, if we tried, I worry that the recent movement towards more expansive religious liberty rights is going to undercut their power anyway.
Mark Navin with us. He is a professor and the chair of philosophy at Oakland University and a lecturer in the foundational medical studies at the Oakland University William Beaumont School of Medicine, joining us on the Oakland County Megacast. And Mark, for many of those that are out there that will not get the vaccine or refuse to get the vaccine, they're making an argument that is very commonly seen in other bodily health arguments, such as reproductive health and in abortion and in a number of other health issues. It's my body, it's my choice. I choose not to get the vaccine. The whole point of the vaccine is to get enough of the population to be theoretically immune or not in a deadly position from the virus, so that it's not necessarily a huge issue. So for those that are going to claim my body, my choice, I don't think I need this vaccine, I don't want this vaccine, whether it's a religious reason or not, what can be done at that point to talk to them about the importance of this vaccine? Or are they at that point, because of the whole point of the vaccine, in a sort of a clearer position where they can make that choice, and it's just a matter of a certain percentage of the population needs to not make that choice in order for this to be applicable?
It's a really nice point, and I want to make sort of two responses that maybe aren't on point and maybe push me some more. So the first is that there's an important distinction between clinical ethics, the sort of ethics of agreeing to healthcare treatments, which should prioritize informed consent, right? That it's my body and I get to decide whether you're going to do surgery on it or not, whether you're going to start chemo and whether I'm ready for hospice, right? That's clinical ethics, and informed consent is primary. In public health ethics, where we're talking about risks to others and to the community, and especially risks that I could impose on others by infecting them, then it's not only my liberty that matters. Now, how to balance my liberty against protecting the community, that's the central problem of public health ethics. But I think that distinction is fundamental to keep in mind. And relatedly, I think it's worth considering that all of the laws, all the major laws and policies we have on the books for vaccines, everything from the Supreme Court jurisprudence of the early 20th century to the current sort of school requirements of the 1960s and 1970s, those all were written before informed consent became an institutionalized part of our medical care in the 1970s and 1980s. We sometimes forget like how new the idea is that patients get to call their shots when it comes to medical treatment. And you're entirely right that there's a conflict set up between that rise of patient freedom in the 1970s and 1980s and the public health orientation of our laws and policies around immunizations. And people that take for granted that that's an easy circle to square aren't paying attention, I think, to the kind of tensions that you're identifying. And the short story is, we as a culture in America are struggling to commit ourselves to a conception of freedom that protects us from the kinds of oppression our political culture is based on, but also allows us the kind of freedom to live a life together peacefully and healthily. Like, I'm glad that people have freedom to reject medical interventions, sure, but I would like the freedom to go to restaurants, and the freedom to send my kids to school, and the freedom for people to go to church, and the freedom to do all kinds of things we can't do because people are not responsibly making their choices. But we as a culture are struggling with what freedom means, especially the kind of freedom that matters.
Yeah, we're fortunate enough to live in a country where we can make those choices for ourselves, for our families, but choices do have consequences, and you want to make sure you're making an informed choice. So for those that are refusing a vaccine or just simply don't want to have that conversation, you talked earlier about information campaigns, about the misinformation or disinformation about vaccines that may be out there. Where does that start, even if ultimately you're not going to convince some people, because that's just the nature of the freedom of choice that we have in this country?
So, by information campaigns, we could mean a couple different things, and I think both are really important. So one, where you're just doing general information about what the vaccine is and how it works and its very low risks of complications, that's super important. The other kind that actually can move people is when you present people with examples of people like them that are making the choice you want them to make. Because everyone is pro-science. Everyone follows experts. We just disagree about who the experts are that we should follow. And so what we see in successful targeted public health messaging is that you want to invoke the authority of leaders and spokespeople from people's own community. So for one example, in 2019, we had a measles outbreak in New York that spread to Southeast Michigan. And the Southeast Michigan local health departments did an amazing job of reaching out to Orthodox Jewish community leaders and the sort of council of Orthodox rabbis, and to sort of work and partner with them to communicate to the people the importance of getting this vaccine. Oakland County Health Division gave out 2,000 doses of the MMR vaccine in a matter of a couple weeks, which far surpasses the normal, and it was almost all because of the cooperation of Orthodox rabbis. So I think public health's work in this sort of information is not just facts and figures, but it's about convincing people that people like them are on board, because that's how we get persuaded. We are tribal, monkey brain kind of people who largely want to do what people like us are doing. And if you can pick that up by the right handle, then you can change some minds.
Yeah, it's amazing to watch how this, in some regards, is teaching us that we've got to expand our circles and reach out to individuals, and how much public perception really plays into this. From someone with your education and your experience, what are your thoughts about watching how the pandemic is playing out in other countries, such as China, where maybe they don't have the same public rights and the same public discussions that we're all having here in America? They're saying now it's pretty much contained in China.
Well, and I mean, every country is different. So you're right. I wouldn't want to be in a China, but even, Taiwan has things well under control. New Zealand has things well under control. Now, both those are island countries, so it's easy to control people who are coming and going. South Korea has had mixed success. But you're right. I don't know what the right answer is. How to put this? In philosophy, we sometimes have sort of utopian ideas, like, what if you could remake the world? Let me write a book about like how the world would be great. But that's what politics is. You go to politics with the people you have, and the people you have the values and the commitments they have. And in democratic politics, you do politics based on the agreement you can get out of majorities. And while I would like to believe everyone shared my values, they don't. And in fact, I know that many of my ideas are minority views. And so the question is, given the sort of majority conception people have about liberty and distrust of government, how do we build a sense of responsibility around public health? I think that is connected to the biggest question of our time, because it's also connected to questions about climate change and rebuilding our infrastructure and goddamn roads in Michigan. I mean, that's the question, right? So we care about this freedom and we're skeptical of government, but how can we build the stuff we need so we can go on living together? I wish I knew, but the shorter answer is you can't make me king. Because I don't share the values of everybody else. How can we get people in those kind of communities who do care about this stuff to have those difficult conversations?
And a lot of that, though, I believe is shaped around public perception. And if you can change public perception, you can change the thoughts and the ideals and the implications of so many of these issues. Mark Navin with us here on the Oakland County Megacast. He's a professor and chair of philosophy at the Oakland University and lecturer and medical studies at the Oakland University William Beaumont. Before we let you go, this is a fascinating conversation to me.
Well, thanks, Ronnie. I'm having fun too.
I will say, I think the ethics surrounding COVID-19 and this pandemic, it's sparking so many new conversations that maybe we didn't have before. And it's also bringing issue to the forefront that needs to be addressed. And knowing that, and what do you think is going to be the silver lining coming out of this pandemic? Because let's hope we've all learned something at the end.
I get what you're going for.
Do you think there's going to be a silver lining? Let's just say
no,
that.
No, I don't. I think there's going to be 300, 400, 500,000 dead people. There are going to be millions of people who have lifelong morbidities associated with this disease. I don't think it's going to lead to resolution in some of our institutional failures. I'm not optimistic at all. I hope, of course, that widespread distribution of the vaccine is going to save lives and prevent people from having lifelong morbidities. I'm hopeful that some of our governors are going to come around on mask mandates. I'm hopeful we can overcome worries about acceptance of the vaccine. But I think it's mostly for the bad for a long time. Here's one example. There's so many things we're not paying attention to. You in the previous segment talking about women exiting the workforce. Mm-hmm. That has decades-long and even generational consequences. Right, for family wealth, for family and children's educational opportunities. That is, we're not going to solve that problem. That problem is done. Here's another huge problem. There's been a dramatic drop-off in well baby visits and routine childhood vaccinations. We're likely to see measles outbreaks, associated with this for years to come. People are off the schedule. There are all kinds of negative things coming. I wish I had a silver lining. The silver lining is maybe as of December 11th, the Pfizer vaccine can start getting out there. Maybe the bad can start getting a little better. I don't know. Do you see a silver lining? Because I wish I could find one.
Well, I think there are some things. And one being, number one, is especially in the beginning of the pandemic, we started as a society having bigger discussions about the inequities of healthcare and its accessibility. within minority communities. So maybe, hopefully, that's going to shift going forward. It's not, and I know that as Americans, we typically have a very short attention span, but maybe that opened the door for studies and conversations down the road so that we can make the community a better place at the end of this line. Those little things, I hope, and just the general things, and that it's brought us together closer with our families and our, and what really matters. I
wish that were true. I got to tell you, I keep hearing stories from friends and acquaintances that this has divided their families. That people are refusing to go to Thanksgiving when it's being hosted with large groups, and the people who are refusing to go, they're blowing up their families. I think masks, you responded, I'm sorry you're trying to end on a good note, and I apologize for this, but I actually think it's worse than this. But I'm a philosopher, and my job is to think critically, and sometimes that means that I'm hypercritical. So I hope that I'm wrong, and I hope there are some silver linings here, and I would be very glad if you ever had me back to eat crow for everything I got wrong.
Well, we would love that, but we would also love to have you back anytime, because your education and your experience and your expertise is invaluable to the community, and sharing that. We appreciate that, especially because the conversation around the vaccine, I think in the next 6 months, is only going to continue to grow, because we are going to start to see some of these issues really arise. Do I, Ticketmaster, I need a vaccine to go to a concert, schools, employment. And while it's been pretty standard, like you were mentioning in some of the healthcare industries, what's that going to be like if I work at a local restaurant? Who's going to pay for it? Who's liable? This, that, and the other. But we've also seen, like you said, we've had vaccines around the flu for years, but people are still dying of the flu. So what happens if you get a vaccine and you still continue to spread? How's that going to work? And I think there's so much going forward in the next 6 months, this conversation around the vaccine and the ethics of the vaccine with doctors and schools and employers. It's going to have a direct impact. I think the conversation is going to shift that way. So it'd be great to have you on, and your expertise as well. And thank you for sharing your knowledge with us.
Well, thanks for having me join you today. It was great.
Anything quickly before we let you go? Anything? I was trying to leave you on a positive note, but you.
Well, I'm sorry.
But anything else maybe I didn't touch upon that you want people to know?
Well, so just this, if you've got kids, please keep them on the schedule. Please get those routine vaccines. Your pediatrician can find safe ways, even in the midst of the height of the pandemic, can find safe ways to get your kids their regular vaccines. We need to keep that going. Yeah, and we have had conversations with other doctors who are stressing that same thing. So thank you so much. We appreciate it. And again, a safe and a happy yet small Thanksgiving celebration to you and your family. And to you too. Thank you. Tyler and I are going to take a quick break here on the Oakland County Megacast, and when we come back, we'll be joined with the mayor of the city of Troy. This is the Oakland County Megacast.
Hi, I'm Dr. Jonae Khaldun. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
This may seem uncomfortable, but so is being hooked to an IV, sleeping in a hospital bed, and fighting for your life. When it comes to COVID-19, comfort is not as important as saving lives. Wearing a mask can greatly reduce the chance of spreading the virus. So mask up, Michigan, every time you leave home.
have you with us here on the Oakland County Megacast. I'm Ronnie Dahl here in my home studio, joined with the one and only Mr. Tyler Keith back at the Civic Center studios in West Bloomfield. So many things are changing on a daily basis here. And just when our elected leaders think they may have a handle on the situation, they are given a new, thrown a new wrench into the system. I guess that's kind of the way to say, right? And joining us now on the Oakland County Megacast is Ethan Baker. He's the mayor for the city of Troy, which, by the way, is the largest city in Oakland County. Great to have you with us here on the Oakland County Megacast.
Oh, I'm happy to be back, Ronnie and Tyler. It's always good to see you both. I actually get to see you today, Ronnie. Normally I just get to hear you, but I get to see you, which makes it so much better. Big smile like that.
Well, it's great to have you with us. And I have to say, every time there's a new mandate that comes down from the state health department, I do wonder about our elected leaders. Even the general public kind of knew something was coming, but from an elected leader standpoint, were you given any type of heads up?
No, not really. I mean, the way it works today, I mean, we all kind of had a heads up that something was coming, but I think that's really the result of social media now, right? I mean, things leak much quicker to the mass public than they ever used to. So I was kind of finding out as you were finding out. I mean, you hear grumblings as you go along, and you see numbers going up, and you hear warnings coming out of Lansing saying something could be coming, something could be coming. But no, I didn't know any more than anybody else did on that Sunday that restaurants were going to close again, bowling alleys, movie theaters and such. I mean, that was kind of a, surprise Sunday evening, right? But we deal with it. That's one thing we've learned, is that we take one day at a time with COVID and expect the unexpected. And that's how we're living, unfortunately, which, we've been doing it for almost 9 months. So you get used to that aspect of it, but it is hard.
What have been the calls coming into City Hall since that announcement? Are restaurants calling you, trying to figure out, can we do this? Can we not do that? Because there has been discussion about, hey, a lot of these restaurants have invested in those little igloos, but are those considered indoor dining? So I would imagine City Hall is getting flooded with phone calls.
They are, and our code enforcement and planning department handles all of that aspect for the city, and certainly there has been an influx of calls coming to me directly to see if I could connect people with the right people at City Hall. And it is a difficult question. Well, suddenly if you enclose an outdoor space and it's airtight, doesn't that make it an indoor space? I mean, is that indoor dining now? And yet we know, as I'm looking outside right now, it's cold and you can't sit outside like you could in July and August and eat, which really helped our restaurant industry deal with some of the issues. So yeah, it's been busy getting a lot of calls. I know a lot of the smaller restaurants can't afford to invest in these kind of outdoor enclosures, and they're the ones that are really struggling through all this, and that's what breaks my heart. I happened to be at a coffee shop on Sunday before that order came down, and I was talking to the owner and said, Ethan, if there's another shutdown, I don't think I can make it this next time. I barely pulled through the last time, but if there's a shutdown, the only thing that was keeping her alive is the fact that she could have people come in and sit socially distanced in her cafe because there was enough space for it. And she's just not in a location where people are going to grab and go. So that's the most troubling aspect of all this is, and the bigger, the more corporate type restaurants, they have the resources available to make a go of it. But the smaller mom and pop ones, this is supposed to be their busy time too, and they're not getting the business they need to survive.
Yeah, and so you wonder, I mean, there's going to be such a trickle-down fallout from this. And in that situation, a lot of people, for them, little coffee shops like that were their lifeline because maybe they couldn't get Wi-Fi at their home, or they were surrounded by kids trying to learn and this, that, and the other. So these coffee shops were kind of their escape, where they could work in peace, and then that increases the business, and then you take that away.
Yep.
What are you going to do? And from a mayor's standpoint, what is your conversation on the flip side of that? Because they don't have the federal support that they did the first round.
Certainly not yet. I mean, we've been watching Washington work through a second, or not even a second, it's really a fourth or fifth round of stimulus when it comes down to it, but trying to get them to come up with something. Obviously, the campaign and the election slowed that down and probably made it 10 times worse than it needed to be. I am in contact with our congresswoman here, Haley Stevens, and she's optimistic that they can get a deal done sooner rather than later, just so there can be something coming. Because as you know, just because a deal gets done now, it doesn't mean that there's checks in the mailbox the next day, right? There's that lag time, and Washington needs to step up here, and the leaders we have there need to recognize that these businesses can't survive, and these people can't survive without the help that they need. And as a reminder, these people have paid into the system with taxes for all these years for a time like this. And I think that's something that gets lost sometimes in this conversation, is this isn't just about free money. It's tax dollars and taxes that people have paid into a system for years on end. And it's time for some of that to come back to them a little bit when they really need the help. And there's no denying we really need the help right now.
Yeah, and even right now, the state of Michigan is saying basically, for all these employees that are going to be losing their job, because, and we got to remember, like, when we're having this conversation, we tend to focus on the restaurants and the bars. But sure, this is so much more. It's the movie theaters that just reopened. It's the bowling alleys that just reopened. And for them, this is their height season because of the leaks. So sure, shutting them down, they're probably not going to survive this. So when they have a conversation with an elected leader and you say things could be in the pipeline, right, for them, that may not mean a lot right now, because they still have to put food on the table. They still have to keep their lights on. What do you want them to know? Is the city, because we saw in the city of Dearborn, it was Dearborn, where the local donut shop was issued a misdemeanor citation for people sitting down in the restaurant. Is that going to be happening in the city of Troy? Because you have a long, well sought out industry of people wanting to go to your restaurants for that experience.
Well, listen, I can't sit here as the mayor of a city and say our police aren't going to do what they're supposed to do and enforce the law as it stands, right? So that's definitely, you're not going to catch me saying that, right? But,
But you had the conversation. Go ahead.
Well, no, I mean, we talked about it before. And frankly, most businesses and most people follow these orders and they do what they're told to do. And that's the right thing to do to help stop the spread and to do all the things we're supposed to do to get the pandemic as much under control as possible. We did have some businesses that opened that weren't supposed to be opened back in the previous shutdown period. And, our local law enforcement did everything they needed to do to enforce the order. But you have to recognize that we're limited as well as a city. We depend somewhat on the county sheriff's office and the state government as far as their prosecutorial ability. So I guess I'm trying to say is, can a donut shop owner expect someone to come arrest them? Probably not. Does that mean they should open and let people in? Probably not either. I mean, enforcement's always going to be the most difficult part of these orders. And, the people in Lansing know that and understand that. But they're counting on the bulk of us to follow the rules to get the pandemic under control.
And knowing that in the city of Troy, we've kind of talked about this before too, but I think about the tax dollars and what is this really going to mean to your bottom line? I know that the city of Troy, you had basically a cushion, but how long can that cushion last?
Well, it's interesting. We're very fortunate in the city of Troy, and most cities and townships throughout Michigan are heavily based on their property tax revenue to fund their budgets. So, unless there's a housing crisis, our revenue is going to stay pretty much steady. Certainly, if this goes on too long, businesses shut down. It's not desirable to do business in the city of Troy, which means our housing market values go down. Then we'd start to see the effects of our bottom line being reduced based on those revenues. I'm pretty confident that's not going to be the case. Structurally, Troy is in good shape as far as a place to do business. I think that we'll bounce back and have people back in office buildings probably sooner than other places because of our great infrastructure and what people have come to know and love about Troy. We are affected obviously by state shared revenue that comes out of Lansing. We know that the state budget's really struggling. This year they managed to plug the gaps with the money they had in their rainy day funds. I'm not so sure about next year. My big concerns are what happens when the pandemic is pretty much, we've got a vaccine, we've got whatever, herd immunity, people are doing fine. But there's always a couple year lag with property tax values. So is it 2 or 3 years from now that the city of Troy's budget looks bad and people are thinking, well, wait a minute, COVID was 2 or 3 years ago, right? I mean, that's bigger my concerns at this point. But in the meantime, Troy's going to be just fine. And we feel good that we've got a plan to get through it. We're tightly and fiscally conservative when it comes to our budgeting anyway. We do have that extra cushion. We just need to make sure Lansing can still give us our share of the revenue that we expect as best as possible for as long as possible.
Ethan Baker with us here on the Oakland County Megacast. He is the mayor for the city of Troy, the largest city here in Oakland County. And I know that you said the housing industry is actually doing very well right now, especially in the suburbs, because people are moving further out because they get to remote learn and they need more space. So they can get that space at a cheaper rate than what they could maybe in an urban setting. But knowing that the key component of that would be the remote learning. Mm-hmm. How concerned are you when you're talking about property taxes? The city of Troy, you have so many office buildings. Yeah. What if these employees don't return to those buildings? How does that impact your bottom line?
Absolutely. I mean, and right now our property tax split is about 65% residential, 35% commercial, which is actually way skewed towards the residential historically. But absolutely, I mean, and I think we've got at most 20% occupancy in some of our buildings right now, which, that's not going to sustain for our restaurants and retail, but also for the landlords. People have leases, so they're paying their rent. And I don't know the specifics of what our landlord tenant relationships are like throughout the city. I'm sure some have worked with their tenants to deal with that. But yeah, at a certain point, if people aren't coming back to offices, then they're not going to have their money to pay their mortgages and their property taxes, and that would affect us. I still think Troy is probably better positioned than even say Southfield or some of the other more built up communities, because we're known for our good infrastructure and we're known as a draw because of our freeway access and because of the place. People want to do business here in Troy because of our great schools and our great housing. It kind of creates a great all-in-one place for a business to locate. And through the pandemic, I was talking to our economic development specialist, Glenn Lapin, the other day. We've had several new companies move into Troy, even during this time, banking on the fact that this is where they want to be when things do get back to normal. So I still feel good about all of that. Ask me again, maybe another, we'll keep checking in on that one especially. But I'm trying to get away from the cataclysmic aspect of, the sky's going to fall completely and we're going to have a bunch of empty buildings and no property tax revenue anymore. I mean, in fact, if I thought about that on a daily basis, I'd probably make myself crazy. But there's going to be some that pull back, and yeah, that'll affect us. But we're prepared for it. We plan, and if you can plan and budget, then we should be okay.
Well, and that's the one thing about the business industry. They're not planning for today. They're planning 3, 4, 5 years out. Right. And so this could be a blip. But I do think a lot of companies have realized during this pandemic, they don't have to have their people in the office, or definitely not Monday through Friday. So maybe you have a work day of 1 to 2 days. Yeah. So and of course we could see innovation out of this, into which more businesses are just doing like shared space, something that comes out of this. But I think this is going to be one of the long-term conversations that keeps going out of this pandemic. People returning to that downtown, office building Monday through Friday, 9 to 5. But then that, and the trickle effect of that, obviously the restaurants and parking revenue, so many things come out of that. So, but if we could switch gears just a little bit.
Sure.
The election is over, somewhat.
Oh yeah, we had an election. That's right. Right. I forgot all about that. Yeah.
It's so crazy. It's only November 23rd, but it does seem like it was like 4 months ago, right?
The longest year in the world, I'm telling you. There'll never be another 2020, I hope, as far as everything. But yeah, we did have an election. Our municipal elections are an off year, so we didn't have anything other than a library millage on our local ballot. But I will say, I mean, you didn't really ask a question, but I'll tell you, our city clerk did a fantastic job of handling in 2 elections this year, the August primary and then our November general election. She was innovative and creative, and we had some great resources for our residents to be able to vote safely from their cars at various drive-through city clerk events. And of course, all of our polling precincts were open on election day, well serviced, well staffed, properly spaced, full of PPE. So we had a really great experience in Troy. And even with all of those absentee ballots that had come in early, that was unprecedented for us. But we were able to get everything tabulated and properly taken care of by about midnight on election night. So I was very pleased with that, with record turnout, almost 77%.
Wow. I will say, I think that's one of the great things that might come out of this pandemic and this election cycle is it really did spur people to go vote and have their voice heard. But knowing that, what do you think was put in place from your clerk's office that maybe is going to stick around because it really works so well?
I think, people really liked the drive-through clerk that we did. People like to sit in their cars and do things. You see drive-thrus are full all over all the time, right? Even in non-pandemic times, there's something very peaceful and easy about sitting and driving through a line and getting the work done that you need to get done. And I think that's something that could stick around even in non-pandemic. Obviously, we're heavily focused on, getting out the vote in the city of Troy, making it easy for people to vote. So I don't know what else necessarily will stick around, but I do think that drive-through clerk aspect is something that could continue. I just think people like the ease of it and the comfort of it, and we'll see.
That's America for you, though, right? I mean, I'll sit there, if I go to Starbucks, I'm like, yeah, this line's really long in my car. I'm sure I could walk inside. But I'm just going to sit here.
Absolutely. In fact, speaking of Starbucks, we had a Starbucks at Crooks and Big Beaver that actually just closed. And it was, I talked to them right before they closed, and I said, what's going on? You guys are busy all the time. And they said, we're landlocked here. We don't have room to expand. And all the Starbucks in the area are moving over to a drive-through format because people really do just prefer to stay in their car, even in non-pandemic times. Again, it's not just about the pandemic. Like you said, you could probably get in and out in 4 minutes if you walked in, but you'll sit for 15 minutes in the drive-through line at Starbucks, right? I mean, that's just the reality of it. So I think people like a drive-through. I guess we can thank McDonald's for that. I think they started that a long time ago, and we'll see.
Plus, we have entertainment in our cars now.
Although we're not supposed to be using that entertainment in our cars. Listening to the radio is okay. Let's not look at our phones, right?
But if you're sitting in line,
technically that's true. Just remember, in the city of Troy, it's illegal to use a handheld device when you're driving. So we have that specific law.
Ethan Baker with us here on the Oakland County Megacast. He is the mayor for our fine city of Troy. I do kind of have a question. I went to Somerset recently. It was packed.
Yeah.
It was crazy packed, and I was really surprised. Do you want to talk about the new orders and how does that really impact some of these larger entities in the city of Troy?
Well, sure. I've been working very closely with the Forbes company, who's the owner and operator of Somerset, and I talk with them pretty much weekly just about a lot of stuff going on. Obviously, it's a huge part of our city and a big economic driver for us. But they're doing very, very well. Obviously, this is a busy time of year anyway, but they've gone the mile to make sure it's a safe experience for people across the board. And, they're fortunate that the orders don't affect them in as much as they've got a lot of space, a lot of square feet in Somerset overall. So they can spread people out and move people around. I'm actually supposed to go there and meet with them either later today or tomorrow to hear about their holiday plans specifically, because obviously, as you know, I'm sure you've been at Christmas time, there's Santa Claus and that big display, and they move a ton of people through there. So I'm anxious to see how they plan to do that this year. But Somerset is doing very well. People can go there and expect a safe experience, a good experience. And I encourage it, if they're safe and healthy, to do so, because it's a big part of the holiday atmosphere in this city and around the region, really, as you know. I mean, you don't live in Troy, but you were at Somerset. So we draw people from out of the city.
Oh, everyone goes to Somerset. I have, friends or family, when they come in town from out of state, they're all like, can we go to Somerset? I'm like, no. But it has that type of reputation. And also, this is Thanksgiving week, and we're going into the biggest shopping season of the year, but we're also doing it in the middle of a pandemic. So right. I do wonder, what are those crowds going to be like on Black Black Friday.
Yeah, Black Friday. I think obviously there's going to be a record amount of online shopping this year. That we've seen it all year, whether it's groceries or any other supplies that you need, and certainly that's going to play out for Christmas shopping. But I also think you'll see plenty of people go out and do in-person retail shopping on Black Friday and throughout the next month, basically. I obviously encourage, you have to wear a mask when you're in Somerset, and they want you to keep socially distant. They don't want you there if you've got a fever or been exposed to anybody. So all the same CDC rules apply. And, the individual stores, I think it's really important on us as consumers who go there to help them enforce the rules and do the right thing. I mean, it's difficult for a store manager to say, hey, you can't come and spend money in my store because you don't have your mask on right. So wear your mask right and don't put them in that uncomfortable position. That would be my advice. But we're going to do what we're going to do as people do, and we just hope that everyone maintains the right level of safety when it comes to that. But Somerset, retail struggling prior to the pandemic. Somerset's doing very well, and I know that they're going to keep working hard to stay innovative and fresh so that even coming out of this pandemic, there'll still be the experience that people expect.
Before we let you go, anything that maybe we didn't touch on that you want the listeners and viewers to know?
Really, obviously it's Thanksgiving this week. My family's having a very different Thanksgiving. It's just going to be the five of us at home, which is wonderful because we love our family. But, we're used to being with grandparents and aunts and uncles and such. So we'll be making a turkey at home. We'll see how that goes. A lot of YouTube videos for how the dinner we're going to prepare. But I just, remind people, stay safe, be smart. Obviously, there are going to be people who are going to get together and do big family events, even though the CDC is not recommending it. But I hope that most of you do, just for the sake of, getting us through this pandemic that much faster. Thanksgiving's a time to be obviously very thankful and grateful. Sometimes we lose that messaging and make it about food and football, which I think is great. But we also need to remember that, let's be thankful for our healthcare heroes and our first and frontline responders. They've really made the difference for us this year and continue to. And cherish every moment you have on Earth. My wife's grandfather's 95 years old, and we got a call last week that looks like his death is imminent, and so we were able to say goodbye to him. But you realize really how important it is to cherish the good moments you have in life when you are younger and you are healthy, when you're with your family before they're off at school. Cherish those moments and be thankful for what you have, even though doesn't always feel like a great life. Sometimes we obviously struggle, but cherish the good moments when you can, and I think it'll help.
It really is about the simple things in life and the people surrounding us. With that, I'm with you. I'm attempting a turkey. I've already been on Pinterest trying to do the recipes. So good luck to you and your family. And again, thank you for your time. We so appreciate it. And but I do want to. The city hall, is it closed right now to the public? I'm sorry, I should have asked that earlier.
Yeah, sure. City Hall is generally closed. We had to open part of the city clerk's office right before the election because it was just too busy, but we are back to being by appointment only, and most things can be done over the phone or online. You'd be amazed. Call City Hall and we'll take care of you. That's our plan.
Well, thank you so much, Mr. Mayor. We so appreciate your time, and a happy and safe Thanksgiving to you.
Thank you, Ronnie. Happy Thanksgiving.
Tyler and I are going to take a quick break here on the Oakland County Megacast, and when we come back, we will be speaking with the CEO for the local area of the United Way. Tough times for them, not only donation-wise, but so many people in the need of help. This is the Oakland County Megacast.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green or blue.
But one thing we can all agree on to help stop the spread of COVID-19.
Wear a mask.
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 The ball's in your court, Michigan.
Great to have you with us here on the Friday or Monday edition. Tyler, I'm already Friday.
We're not even going to be here on Friday, Ronnie. What's going on?
I got the schedule. I was like, oh, we have Friday.
We're Monday to Wednesday this week. Oh, no.
You know what I love about this is it kind of reminds me of my ATF days. In federal government, you get all the holidays off. But when you work in a newsroom, you work every holiday. So, Tyler, a quick story. My first few months with ATF, it was Columbus Day. I showed up at work. No one was in the office. And I'm like, oh, no one's here. And they're like laughing at me. And they're like, yeah, it's a holiday. I'm like, what holiday? And they're like, if there's a mattress commercial, you get the day off.
That's the standard we love to hear from our government agencies, isn't it? Mattresses. That's what the term is.
I know, but crazy time. But I will say, during this pandemic, the federal agencies such as ATF, FBI, DEA, they continue to work around the clock. So we want to say thank you to them. But I will say, people really doing so much of the work right now on the front lines during this pandemic. So many of our nonprofits. What a tough time for them, because in the middle of a pandemic, fundraisers have had to be, canceled. Their typical ways of operating had to be shuttered, but in the same time, the need for their assistance and their help has increased. So to kind of expand on this conversation a little bit, we want to bring in Darienne Hudson. She's the president and CEO for the United Way here in Southeast Michigan. Great to have you with us here on the Oakland County Megacast.
Thank you for having me, Ronnie. Good morning.
Thank you for everything that you and your organization does. But boy, talk about a shift in way you're operating right now, huh?
Yes, it's been very complex. We're fully remote right now, and our United Way is responsible for serving 3 counties, Macomb, Oakland, and Wayne County. We're responsible for 4.8 million people. And so prior to the pandemic, we knew that 44% of our families were struggling to meet their most basic needs. And so, as you mentioned, that's just been exacerbated. And for our nonprofits that are on the front lines, trying to get creative with how we're raising funds, how we're sharing resources, and working together to provide those services has never been more important.
And with that, how are you doing it?
So, we're fortunate that we have such a generous community, that we have so many like-minded people who are determined to help those in need, no matter what's happening around us. So when the pandemic hit back in March, our board approved the release of $2 million in emergency funding to help start the COVID-19 response fund. We are now over $37 million that we've been able to raise for the community. Our partnership with Oakland Together has been critical in making that happen. Oakland County's county executive, Dave Coulter, has just been visionary in terms of knowing where to invest resources to help others. And they've given us now at this point over 17 million of that 37 million. So we've worked with a number of nonprofits. We've given out over 800 grants at this point to nonprofits in our community. We're working with daycare centers. We're providing micro grants. And we're fortunate that we have over 75 corporate partners and foundations that have also raised their hands to provide help. I mean, even now, we know all of this started back in March, but it's Thanksgiving time, and we still have so many people who are very generous in helping us make sure that we're supporting those who are most in need.
So before we talk about the need, can we talk a little bit about your fundraising? Because how has that shifted, and how are you trying to navigate that world? Because so many nonprofits, your usual revenue streams have dried up. So how has that shifted, and how are you still able to gather that interest and gather those donations during a pandemic?
So our United Way has been around now for over 100 years, and we've largely depended on workplace giving campaigns. They happen year round, and this year we had to get very creative. Most of those campaigns have been virtual and taking advantage of a number of resources like Zoom that we have here. Also, Microsoft Teams, whatever it takes to be able to bring these campaigns to life in a very different way. We anticipated that there would be a decrease in fundraising. And so we've gone, just in the 2 years that I've been here, from a $45 million campaign to a $35 million campaign this year. But we are fortunate, again, that we were still able to raise $37 million outside of our traditional campaign. But it's been difficult. So many organizations depend on operating dollars from United Way. It's forcing us to think very differently. We've had to cancel golf outings and a number of different events that we normally would do. And the thing is, Ronnie, as much as I would want to say that things have been tough for us, there are other organizations that really are struggling much more than we are, because we're still benefiting from the generosity of people in our community. And even with the challenges that we're all facing, still having such a steady stream of donations, big and small, from our community members here, it's very humbling.
And so with that, have you had to lay off any employees during this?
No. So we anticipated having to do 3 weeks of furloughs, and we've been very blessed from some very generous donations from local foundations, one of them being the Fisher Foundation, to help us work through that. We also were able to extend our CARES Act funding through October. And so we had furloughs planned for July, for actually this week in November. And from the CARES Act this summer and from the Fisher family contribution to our organization, we will not have to have these furloughs this year. And so just very blessed, Ronnie, to have this type of support. But it doesn't mean that things are going to be easier anytime soon. And again, I feel that we're very blessed to be in this position. We are having to work very differently, very creatively. We all have titles, but they don't mean very much right now. Everyone's rolling up their sleeves to do whatever it is that we can to make sure that all of our families have what they need.
You know, and you hope that one of the things coming out of this pandemic is the collaboration that we've seen on so many different levels continues post-pandemic, because we do kind of feel we're all in this together. What can we do to help one another? And I know it's a little bit emotional to think about that and to think about your employees. And it's tough, you know, and while you as a CEO may be in a different position of someone in a different position, it impacts us all in different ways. So it's beautiful, the collaboration that we're seeing.
It is. Collective impact has to be the way forward. And, you know, that's a buzzword that we love to use in the nonprofit sector and even in education, where I came from prior to my arrival of United Way. But it's a way of saying that organizations are coming together with shared mission and vision and values, the sharing of resources, with data sharing, with really trying to accomplish the same goals around these common issues that one organization cannot do alone. United Way on its own represents well over 1,000 organizations that are connected through our 211 information and referral service, as well as the organizations that we give grants to. So, you know, we've all learned how to collaborate much more efficiently, to make decisions much more quickly, because, you know, people aren't traveling, people aren't going all around the region like they typically do. So you can get people on the call faster. We're able to make decisions and get the help to those who need it much, much more quickly. So that has to be the way that we conduct business going forward, even when we're back to being face-to-face at some point in the future. We have to remember the lessons that have been learned here that allowed us to help so many people. We've served 2.5 million people in our region, Ronnie, through this pandemic. This has to be the way that we do business going forward. And again, it's not United Way. It is in partnership with so many colleagues, so many organizations, so many communities around the region.
And so can you talk a little bit about how has the need shifted in the community during the pandemic?
Sure. So at our height, our 211 call line is 24/7. Typically on any given year, we'll have over 200,000 calls that go to 211. That's about 500 calls a day. During the height of the pandemic in March, we were actually pushing 1,500 calls a day. That number was tripling. And I think most people would assume that the requests for support had to do with COVID-19 testing, but actually, in actuality, that was not the case. The largest number of calls we received were for food and trying to find food pantries, access to resources, because we have so many families that are suffering right now. We've served over 15 million meals, and that's not a bragging right. It really is criminal with how many people are still in need, even up to this point. We've seen quite a few requests for housing support. We have a number of partnerships with eviction prevention. JP Morgan Chase has been a key partner in making that happen, but that's been another large number of requests that we've received. Then, of course, there have been requests, especially in Oakland County more recently, for COVID-19 testing. But the same basic needs that have been at the forefront since before the pandemic started, they're still there. And the collaborative efforts that we've all had previously, we need to continue those if we're going to eventually eradicate these issues that are plaguing our community.
Dr. Hudson with us here on the Oakland County Megacast. She's the president and CEO for the United Way of Southeast Michigan. Recently, the state of Michigan put out the new mandates, the health orders, and I think about so many of these employees that are working in some of these low-income industries that are so severely impacted, such as the restaurants and the bars. But this time around, they don't have that federal support. Unemployment is not easy for them to get. And these are people that are living paycheck to paycheck day by day, and then you take it away from them. How does that shift the need for what you and your teammates are doing?
So it shifts it in several ways, and it's truly devastating that we don't have a relief bill yet from Congress. And so one of the things that we're really pushing is for people to call their local congressperson and demand that we get this relief bill passed. If you're looking for the words, if you want to write a letter, you can go to standwithunitedway.org to find those resources to be able to call and request of our Congress person that we get this relief bill. We're very concerned. You know, this is the getting cold outside as well. So there are a few things that we're trying to do to mitigate some of these problems. One, our Oakland Together partnership. We have micro grants that are available for families, and they're unrestricted. They can use them to support paying their light bills, gas bills. They can use those to help with their food needs or anything that's pressing for their families. And that's actually, they can go to the Oakland County website to see what's available to them. But we've been very fortunate. Again, Oakland County has given $2 million towards this effort just with our organization. So that's the first line of defense. We also have the Michigan Energy Assistance Program, known as MEAP, that's open from 9 to 5, Monday through Fridays. And I know we're at a holiday week, but people can still either call 211 or they can call the number for MEAP assistance, which is 1-844-211-4994. And that's also, again, where they can get emergency assistance to help pay their utilities. It doesn't matter who their provider is, but those are the resources that we're trying to push. We have virtual town halls that we conduct every week to also get this information out to the community. So if people need a little bit more background or understanding on how all of this works, they can go to our website at unitedwayscm.org, find the virtual town halls, and they can actually watch all of these different programs and find those resources to go to the organizations directly that can help them.
Darienne Hudson with us, the president and CEO of United Way for Southeastern Michigan, joining us on the Oakland County Megacast, Civic Center TV, Birmingham Area Municipal Access, 88.1 LaBiff and 89.3 Lakes FM. Darienne, right now, from a distance and even if at all in person, what are the greatest needs from the United Way, from the greater community at this point in the pandemic, and what will be the greatest needs for assistance from the community going forward as this pandemic continues on and after the pandemic, as these issues don't go away with COVID-19?
Right. I agree with your last statement wholeheartedly. So as I've been talking about food, pretty much this whole conversation, that continues to be the top need that we have. There is no donation that is too small. I'm sure you all have been hearing from Gleaners, from Forgotten Harvest. We have a number of our shelters, like the neighborhood service organization, like Lighthouse of Oakland County, that are providing resources for families in our community. And so that continues to be the largest need. I would say, followed by the utility assistance again. These are issues that were pretty pervasive before the pandemic, and it's even more so now. And so making sure families know who to call, where to go. Again, 211 is the simplest place to start, where they can get resources for their utility bills. But I'm very concerned about how we move forward, because it is very difficult to catch up when you've had this much time not being able to work. And I think it goes without saying that everyone's making sacrifices, but this is going to take more than philanthropy to be able to help close these gaps. We need to continue to work with our mortgage companies, with our housing associations to help make housing affordable for people. Again, if you're listening to this and you're trying to figure out how you can provide support in the area of food insecurity, they do have a number of options that are available for people to still be able to volunteer, to donate. Thanksgiving is Thursday. And we have a lot of people that may not have any food on their table, and it really is criminal. So these are the things I would say, if there's something that keeps me up at night, that's definitely it. No one should be sitting here wondering how they're going to put food on the table for their children. So I'm really concerned about that. And then lastly, education. I used to run a school district. Education is near and dear to my heart. And just knowing that our children are home learning, there are many families that have access to the computers, laptops, devices, internet connectivity, but many who don't. And we've been partnering with a number of agencies, with a number of governments and school districts to provide technology to families who are not only in need, but it's just something that all of our school districts should have access to. So I would say that's the other area I don't want us to lose sight of the needs that are there. And our whole Giving Tuesday platform is committed to digital inclusion. So it's something that's really top of mind for all of us. And if you're listening to this, you're trying to figure out how you're going to keep your students, keep your children well educated and engaged. We're hosting a number of fairs digitally. We've got resources available for families so they don't feel that they're in this by themselves.
And Dr. Hudson, and definitely now, I think more than ever, when you talk about the need, that's just the need that you're aware of. There are so many people that their pride is in the way and they don't want to ask for help. And I think the one thing COVID-19 has taught us in this pandemic, never be too proud. Now is the time. It is okay. Everyone on every different economic level, they're feeling the pinch of COVID-19. But as you just mentioned, your background is in education. You were the former CEO or superintendent for the Milwaukee Public School District. And I worry about the kids that school was their safe spot. Yep. School was where they got that meal. School was where they were nurtured, and it was their place to escape. And now we're putting those kids back into their homes where maybe that's not their safe spot. And what do you think may be the long-term impact of this pandemic for kids such as that?
I do believe that it's profound, regardless of the living situation of children and their families. School was something that many of our students could look forward to. And again, for a number of the reasons that you said, whether it was the guarantee of meals, the guarantee of being around friends, or having that one teacher or that coach who really cared and invested in them. I think a lot of parents, you were talking about pride earlier and even confidence, trying to work, and then they're trying to still make sure their children have everything that they need. It's really creating crisis within our homes. And again, that is sometimes I think we think it's only a certain income level, a certain city, a certain race, but that's affecting everyone. It's more pervasive in our urban centers. It's more pervasive for children of color, for children whose parents are working, but everyone is being impacted. And so I think it will take a great deal of patience. We're very stuck in some ways in education in terms of thinking that you have to be a certain age and a certain grade, and you have to progress through that grade within a certain amount of time. And we're going to have to be willing and open to look at these different policies and think about them differently, because our children have lost a year of school. And we all have to just own that. And even the best digital learning environment, it just doesn't even come close to being in a classroom. And we think we need to be honest about that and be willing to engage in discussions around policies that become more flexible as we recover from this pandemic and try to bring some stability back into the K-12 space.
Yeah, it's going to be interesting, the long-term impact of this pandemic on so many different levels, especially in our education system. Although I will say, I think kids are going to be disappointed because they're no longer going to get those snow days. Like, what were the kids? They put the ice cube in the toilet and do this and turn around or whatever they were doing for a snow day. Not going to happen any longer.
Yeah. Now, you say snow day to a former superintendent. Those are the most traumatizing decisions we ever had to make, because there was never a win in any of it. I also think I think even from the colleges, and I went to Spelman College, and it's a very traditional school, and senior year, those last few months, and all of the rituals that you have. And just knowing, I think about our seniors who are in high school. There's no prom, there's no graduation. Like, those are the things that you make it through 4 years of high school to be able to celebrate. And all of that's been taken away. So I think we've got to imagine if we didn't have those experiences, for all the crazy things that happen in grade school. Those are like, a handful of the ones that you're like, that was a good day. That was something that I will always remember. And that's being taken from our students, and they deserve better. So we have to be willing to think outside of the box in terms of how we're going to restore those memories for them. Some of them we won't be able to, but how can we still make school meaningful for them so they have those memories to hold on to 20 years later?
Yeah, and not only so many of those high school seniors lost out on that senior experience, but now freshmen in college. Not quite the same, but we'll all get through this together, and hopefully we really take stock of what is important, and that is about relationships and joining together. And I think maybe in this world we've stopped doing this, especially with social media. But I think now this is bringing us all together. So hopefully we come out stronger.
Amen to that.
Well, thank you so much, Dr. Hudson. It's been great having you with us here on the Oakland County Megacast. She is the president and CEO for the United Way of Southeast Michigan. Quickly, before we let you go, if people want to get involved with the United Way, how can they do that?
Please go to unitedwaysem.org, and you'll see tabs that say Give Now if you want to donate. If you're interested in volunteering, we have a volunteer portal that's wonderful, and a very special hello to Deb Macon from West Bloomfield, who chairs our volunteer engagement committee. And there's literally hundreds of opportunities for people to get involved. And then if you're looking to advocate, if you're trying to make sure we get that CARES Act relief bill, go to standwithunitedway.org so you can advocate for those in need.
Well, thank you so much. There are so many ways that people sitting at home maybe feel like they don't have a power, but your voice is your power, and you can do so and make change just in the smallest of ways. So thank you so much for being with us. It's great speaking with you.
Thank you for having me, and happy Thanksgiving to you and yours.
You too, and happy and safe Thanksgiving to you and your family as well. Yes. We're gonna take a quick break here on the Oakland County Megacast, and when we come back, we'll be speaking with the Director of City Services over at the Orchard Lake Village. This is the Oakland County Megacast.
Michigan, we still need to stay careful because we don't want to go backwards. Back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Tyler, I will say one thing, this show flies by.
That it does.
And every single day I learn something new. So I think it's great. And some of these people we interview several times, but every time I have a conversation with them, I learn something new. And so I hope that our viewers and listeners do so as well. And with that, we are lucky with us to round out the Monday edition of the Oakland County Megacast with Jerry McCollum. He is the Director of City Services over there at our fine city of Orchard Lake Village. You by far, I know Sylvan Lake likes to say it's the prettiest little city, but Orchard Lake is probably one of the most beautiful waterfront cities.
Yes, we're very fortunate to have Orchard Lake obviously entirely within our city, but we also have property on Upper Straits Lake and Cass Lake also. Yep.
Every time I drive to the studio on McKeagle Harbor, I get to go by the lake, see that view of Apple Island, or sometimes at nighttime, I'll put my crazy dog in my little smart car. She likes to go for rides through the neighborhood, and I will take her for a ride just so I can see the sunset over Apple Island. So you're very lucky to work there in Orchard Lake.
Very much so. I've been here 21 years, 11 of them being the Director of City Services, but great community here. We have awesome city council members. Our residents are great people. Just a joy to be here. Absolutely.
And you are a small community, but you're still impacted by this pandemic. 8 months in, what's the status of how you're operating there in Orchard Lake?
Well, you are correct, Ronnie. I think at any community, no matter what your size is, you're impacted by this pandemic situation. Previously, earlier this year in March, when the governor did shut everything down, we went to limited staff here at City Hall. We did shut the doors to open to the public. We've been doing a lot of our business aspects either electronically or through communication through email. It's worked very well. We did open back up after the governor lifted the original order. The order was expired. But now, since the situation seems to be getting worse, we have reverted back to what we're doing in March. And again, working with limited staff, limiting the individuals that come into City Hall to try to help flatten the curve. I think right now this is a situation that everybody needs to do their part to get through this situation and to hopefully get past this.
So with that and the latest orders coming out of the state, anything new happening there in Orchard Lake?
Not really. Again, we did revert back to the closing of the City Hall to the public, again, and working with limited staff. But yet we're still providing the services that are needed. We're still answering our phones, emails, et cetera. We do have some staff members, your administration, that is able to work from home. I am also, but I also alternate with staff on days to help out here. So
it's such a tough spot for so many of us in the community, but when you're also trying to run a city and you switch like that, it can be even more difficult because we also have to remember, like, we talk about everything like, hey, we're online now. Mm-hmm. We still have a population, especially our elderly, that maybe aren't online or they're not comfortable being online. Because I was a member of the Cable Commission, and we would have public outreach. And one of the things we were even trying to teach them was about their remote control, how to use it still, and technology. Yeah. And so what's that been like from a city standpoint?
Well, we try to get information out there to our residents as quick as we can. We do quarterly newsletters, and we've been maintaining that throughout this whole situation, just to keep our residents informed, especially, as you indicated, Ronnie, the older ones that don't have the technological skills that us younger generations have. One of the struggles been is the city council meetings. As you know, everybody's went to the virtual platforms, Zoom or another method, and it's different because we're a very personable community. We try to be very personal with our residents, and when you're doing everything on the computer or not in person, it was a little bit of a learning curve. It was a change because we are usually very fortunate to interact directly with our constituents and with our residents. Mm-hmm.
And so, knowing that, what do you think Orchard Lake has done as a community there at City Hall that has actually proven to be more time-consuming or less time-consuming, and maybe a better asset to the city so that they can continue it going forward? Because we're all looking for cost-cutting measures. So is there a way to maybe cut the costs from this pandemic that can go forward post-pandemic?
Well, we're very fortunate that we've able to get a couple grants through the CARES Act for some of the measures that we had to put in place here at City Hall when we were open back up: sneeze guards, hand sanitizers, obviously face masks, etc. And we're fortunate enough to have our DPW guys that do sanitize City Hall 3 times a week relative to the COVID situation. But I think that the biggest thing is that we've still been able to maintain business properly, not only with our residents, but with individuals that are pulling building permits or mechanical permits, etc. We've been trying to be very accommodating to them. We actually will go out and meet somebody in the parking lot there to obtain information or take plans, take petitions from them or whatever they need. We try to service the public the best we can, even by meeting them face to face, but obviously keeping our social distance and keeping our precautions in place.
So just a couple more minutes here with us on the Oakland County Megacast, Jerry, and I do want to talk to you a little bit about the Janet Green Memorial. You guys had a beautiful service there recently. Yes. For those not familiar, do you want to fill them in with what you did and how you're honoring her and her service to the city of Orchard Lake?
Yeah. If you don't mind, Ronnie, I'll just go back a little bit and explain. Janet Green was city clerk here for 36 years. Astronomical in many aspects of what has occurred through the city. The construction of City Hall, the water and sewer projects, the acquiring the 50-acre nature sanctuary. But she was the heart and soul of this city for quite a long time. And unfortunately, she did pass back in July from cancer. Being a very dedicated individual that she was and a public servant that she was, we felt that we wanted to do something, including City Council and the residents here at City Hall, to honor her. So what we did is we did have a memorial service for her, and we constructed a water feature, and it is in front of City Hall, so whoever comes into City Hall can see it. Even if you don't want to come into City Hall, you can drive by it. It is right out front at the front entrance, and we did a dedication about 2-3 weeks, longer than that, probably 4 or 5 weeks ago on that. And Civic Center TV came out, did a great job on the filming of it, and it was just a good tribute to a truly awesome individual.
And sometimes we forget about people that work amongst our midst within our city governments and the work that they actually do in and out. And we just rely on them to be there. Mm-hmm. And for the system to work, but you have someone like her, and it wasn't a job, it was a service to her community. So it was a beautiful tribute that you and all of your team members did there for her. But what do you want to know? What do you want to say to the next generation the young kids, like who are maybe looking at life, about to graduate college or high school and trying to figure out life, why they should even look at city government?
Well, it's not a career for everybody, but it is. I've been doing this, been in city government for about 31 years, 21 years at Orchard Lake, and it's a way to serve. It's a way to give back. I think when you do become a public servant, you have to reach out to people as if they are your friends and provide a service. I think the level of service is very important, and we try to strive that here in Orchard Lake is to provide a very high level of service to our residents, which they deserve. I mean, they pay taxes, no different than any other community. But I think the biggest thing, and that I really got from Janet Green too, is to be kind. Be a good person. We have so many other things in life that are negative and stuff. Be positive and be kind and be true.
Be kind. Those are good words to leave on. Thank you so much, Jerry, for being with us on the Oakland County Megacast. Tyler and I will be back tomorrow at 10 a.m.